Welcome back to the Your Health television program hosted by the Monterey County Health Department. I'm Sciolto, your host today, and just about every third Monday of each month. Our topic today is childhood lead poisoning prevention, as next week is National Lead Poisoning Prevention Week. I'd like to continue our discussion on preventing lead poisoning by welcoming my next guest, Ms. Reeves, Supervising Public Health Nurse and Coordinator of the Monterey County Health Department Childhood Lead Poisoning Prevention Program. Welcome, Ann, and thank you for taking the time to join us today.
Thank you. It's nice to be here.
Your program name got me a little tongue-twisted there, Childhood Lead Poisoning Prevention Program. So we talked a lot about exposure, we talked about how to prevent it, the sources of lead, and Rosario mentioned a little bit about testing. Can you kind of expand on that? When should children be tested?
Sure. California regulations require that children in publicly supported programs such as Medi-Cal, Healthy Families, WIC, Head Start, the Child Health and Disability Prevention Program, CHDP, those kinds of programs, the children should be screened at age 12 months and 24 months. And if they miss the 24-month test, then anytime between 24 and 6 years, they should be tested again as well. For children not in those publicly supported programs, the doctors are required to ask a question. And the question is, does your child live in a home that was built before 1978 that has peeling or chipped paint or has recently been remodeled? And if the parent answers yes to that question or I don't know to the question on the age of the home, then that child should be tested as well.
Okay.
And then there are other times too. It's not limited to just those time periods. As we've mentioned, children are at risk from birth to age 6. And then even on after that, the child could have a lead test if a parent requests it from the doctor, or if based on the child's history, the doctor suspects that there might be an exposure. Anytime they can have a test, or if a child was born in another country or spent some time in another country that is known to have environmental lead, then that child should be tested.
Okay, so it's not just you test once and you're in the clear.
Right.
You know, it really depends on the environment in which the child moves into, or you know what I mean?
That's very true.
Okay.
Very true.
So when a child is exposed, how can you reduce that exposure once the child's already, been exposed?
A lot of the reducing the exposure is sort of like the avoiding the exposure.
Okay.
Knowing the sources, staying away from those sources, and practicing good nutrition.
Okay.
A healthy diet and vitamin C, iron, and calcium. Foods rich in those are the best way to try to keep the lead from being absorbed in the body.
So it can actually work against the lead once it's sort of been introduced into the system?
It can compete with the lead and the other nutrients compete, and so when you have the other nutrients, the good nutrients in place, then there's less place for the lead to be absorbed in the body.
Okay.
So it gets eliminated.
Good fruits and vegetables always win. I'm telling everyone right now. So I don't want to deviate too much from the course here that we're on, but we've mentioned a little bit about imported candies and nutrition and lead, and now we're kind of coming up on Halloween pretty soon. Is there anything you can share with our viewers in terms of maybe how to identify a candy that's been imported or candy containing lead, or?
There has been a recent recall of a U.S. candy, the Red Vines Black Licorice.
Oh,
that was announced. I love black licorice. However, most of the recalls that we see for lead-contaminated candy are imported candies. And we don't know, some batches might be safe and some might be harmful. Some candies might be safe, some harmful. So the best advice we can give, especially for children ages 1 to 6, and also for pregnant women, is just to avoid the imported candies.
Okay. Very well. Is there some type of medication that could be taken if a child has been exposed to lead?
There is a medication that's given if a child has a very high lead level.
Okay.
The doctors want to reduce that level very quickly. There's something called a chelating agent that can be given. The children have to be carefully monitored with that, and sometimes they're hospitalized to have that monitoring happen.
Oh.
So we try to avoid that if possible. There is occasionally children that have high lead levels also are found to be anemic. So a medication that's sometimes prescribed is iron supplements, just to support reduce the anemia, and also to reduce the lead absorption.
Okay, so there's want to avoid it, but there's a few different things that you can do right away to kind of stop the process of the lead becoming more present in the body.
Right.
So what about pregnant women? If lead can be passed through the placenta to the developing baby, as Rosario mentioned, should pregnant women also be tested then?
The Centers for Disease Control and Prevention, CDC, has published some guidelines for identification and management of lead in pregnant women and breastfeeding women. CDC does not recommend testing of all pregnant women.
Okay.
However, if there's a woman that thinks she's at risk, definitely the advice is to talk to her doctor about whether or not she should be tested while she's pregnant. And risk factors could include recent immigration from another country. Some pregnant women have a habit of eating non-food substances. It's called pica, when they eat dirt or clay or starch. Some of that food might have lead in it, and so that's a risk factor. They might be exposed to lead at work. If they have poor nutritional status, they could be absorbing more lead. Or if they use traditional foods or cookware, cosmetics, or home remedies, they also could be higher at risk. And so any woman with those kinds of risk factors should definitely talk to her doctor about being tested while she's pregnant.
Okay, so it's really about knowing, like we said, kind of knowing what the sources are, just knowing exactly and being vigilant about that too. Really kind of going through your home and saying, okay, this dish right here, I'm about to heat up my food in the microwave and then eat right from it. Just being vigilant is really...
That's true. That's true. The foods, the cookware, paints, everything.
Especially because when you're pregnant too, you're eating a little bit more.
Right.
So is breastfeeding okay if a mother is known to have, lead in her body or her system? I don't know how to say really, is known to have lead present.
Sure, exposed to lead. According to the CDC guidelines, breastfeeding is generally considered safe in most cases. And usually the benefits of breastfeeding far outweigh any of the risks. So we want to try to encourage that. But lead can be passed to the baby through the breast milk. So the mother, if she has a known exposure, should, again, take those precautions and try to reduce her lead levels while she's pregnant and then after, avoiding in nutrition, same things. And then after the baby's born, monitoring the mom's levels and definitely the baby's blood lead levels. That can help make the determination of whether or not to continue breastfeeding. If the baby's levels stay relatively the same or go down, which is what we want, then it should be, most likely it's fine to continue breastfeeding. But if they go up, then there might be a conversation needed there.
Okay.
But we definitely encourage the mother and the doctor to have that conversation.
Okay, so some close communication with the doctor, and we should, identify if there's any issue. So what? Now you're the coordinator of the Childhood Lead Poisoning Prevention Program. I said that right.
Yes.
What does this program do? What does the program have to offer?
The state provides the guidelines and the funding for this program. And the counties are responsible for all the activities to meet the program's missions. And the mission is to eliminate childhood lead poisoning by identifying and caring for lead-burdened children and reducing and preventing environmental exposures to lead. So in our local program, we have a health educator, we have a public health nurse, and we have the environmental health specialists. And then we have support staff as well. And just very briefly, I'll talk about each of those positions because they certainly do a lot more. It's a great crew.
Oh, go ahead. We have time.
Okay. Rosario Aguirre is primarily responsible for the community outreach and education. She'll do individual training. She'll work with groups. Many times she'll collaborate with other partners in the community. For instance, this week she's participating with a lot of the binational health activities that are going on. And then Stephanie Bischoff is our public health nurse. She works with the doctor's offices, letting them know about updates to the program, letting them know about the screening regulations and the ways to manage the lead levels once it's been detected. Working with the families for children who have high lead levels. She works with them in case managing their cases, providing them education, empowering the parents to help to take care of their children. And then our regional environmental health team works with the nurses going out and doing home investigations to try to identify environmental sources of the lead.
Okay. So you have like a community liaison there, a provider, sort of someone in charge of dealing with providers and making sure that they have all the latest, and then your partnership with environmental health to find out what exactly is causing the issue.
Correct.
Very comprehensive. Yes. So how does your program find out about children's lead levels? How do they hear about an elevated lead level, or one over the a lead level that's over the 5? What is
5
the
micrograms per deciliter?
Yes.
The reference value? Yeah. We find out in several ways about the lead levels. It might be the doctor's office calling us if they have a high level reported on one of their children. We could get a call from the lab or a fax from the lab with the result. But one of the main ways we find out about the levels is through the state reporting system. So any lab that does analysis of blood for lead is required to report to the state. And then the state sends us periodically the results of data on the Monterey County children. So then we take that information, and our staff then contacts the parents and provides education by phone. We might mail them the brochures. And then if the children meet a state-identified criteria for case level, then our nurse and the environmental health specialist go out and conduct a home visit.
Okay, so is the Monterey County lead level higher than the CDC recommended? The level that the CDC recommends action should be taken, or is it at the same level?
Well, there are different activities based on the levels. The state defines what they call case criteria for when our nurse and environmental health specialists are required to go out and do a home visit. But the state certainly encourages us to do more activities to let people know about lead and the dangers of lead. So for case criteria, we follow the rules for that. And then for those with lower than case level, that's when we provide the education by phone and mail.
Oh, okay, so depending on the situation, it's really just dependent on the situation. You know, what the level is per individual, and then that will determine what type of activities you're doing.
Correct.
Okay. So you mentioned about the home visits. Tell me a little bit more about that. What types of questions do you ask during home visits, and what are you looking for during these visits?
The home visit is a great opportunity for a visual inspection of the living space. We're seeing it from fresh eyes, so we might be able to identify something that to the parent is commonplace and doesn't seem to be harmful. So we can see something that they might not be aware of. We also have the accumulated experience. We know a lot of different sources, and so we can kind of look around the house and see if we see any of those kinds of sources present. The home visit also gives us a chance to connect face-to-face, so the parents have a face and a person behind the phone calls and the letters that they're going to receive. And it's also a good chance for us to kind of assess whether they're understanding the information that we're giving them.
Okay.
So this questionnaire is quite lengthy. And it covers things, information about the home, the condition of the home, whether any other family members have been found to have lead exposure, where they've lived in the last year or so, or where they have contact greater than 4 hours a week. Maybe a daycare or a school or a relative's home might be a source of exposure on top of or instead of the home environment. So we don't know that. We look at whether they've traveled outside of the U.S. or they were born outside of the U.S., whether they've been identified as eating paint chips or non-food samples, or whether they use the pottery or home remedies. We ask about the parents' occupations, their hobbies, to see if those might be sources of exposure. So at the end of that, we kind of come up with our best guess of what the source might be in this particular case. Yeah,
you guys are detectives, actually.
Yeah, that's very
lead
true.
Detectives. You mentioned a little bit about being outside, being somewhere else for 4 hours at a time. That's interesting. It's not just the home in which the child lives in. I mean, like you said, daycare is what we're talking about here, I'm assuming?
Right.
And things like that, places like that.
Right. So our initial exam is typically the home that they live in. But in fact, they might spend a lot of time outside the home, and we have found cases where there's been exposure at different places. besides the home environment.
And that's a nice way for messaging, that education to kind of, get out further. You come to a home, there's nothing in the home that you found. Then that parent has to kind of go to their networks, everywhere that their child is, goes and has to spread these messages, these prevention messages.
That's very true. Yeah,
they work for us too. So what type of follow-up is conducted for home visits? If you determine that there's presence of lead or not, you mentioned a bit about letters and calling the parents, and
we do. So after we do the home visit, we provide education for them. Us at the home visit too, we talk about the testing schedule. There's repeat testing to monitor the lead levels, make sure that they're coming down the right direction. So we monitor those levels, and when it's time for another test, contacting the parents, contacting the doctor's office, and just making sure that link happens and the additional testing happens.
Okay, great. So there is a way to ensure, you do monitor throughout, you monitor pretty much until the child's lead levels come down.
We do.
Okay.
We do. The state, just as the state has defined case criteria, initiation of a case, they also have defined when a case can be closed. And the local program can determine whether or not to continue following and reminding the parent after that time, after the official case closure, but we do follow until at least the state's criteria has been met.
Okay. And I think we have just enough time for about one more question. Where can people call for more information on any of this we just talked about?
Anyone with questions about lead exposure and health can certainly call our office. We're happy to provide information, whether it's just phone information or brochures. And our phone number is 831-755-4704. And we have brochures available English and Spanish. We also provide the education programs in the community to schools, to churches, to doctors' offices. So if there's any groups that are interested in having presentations, again, please call us at our office.
Wonderful. Thank you, Anne. It was really great to talk to you. There's certainly a lot that goes into this effort. So thank you again for taking the time to be with us and explain, all of that goes into this. As Anne mentioned, the number to call for more information and or with any questions about lead exposure and health is 755-4704. That's 831-755-4704. And right now we're going to take a short break, but don't go away. We'll be back in just a moment with more of the Your Health Television.